Okay. So at the outset, I wish to thank the Nova team for giving me this opportunity to interact with you all. And as Aisha must have mentioned that we are learn or know more about diabetes. And when she has asked for the introduction from the I can see the people from the different part of the country. And I'm sure what I can guess from the voice about the age, majority of the people are between, say, I can guess this between 30 to 40. So am I right?
Uh, Partially, sir. I'm just 25 years old and having the
Oh,
same issue.
so I can say in like between, say, like second and third decade, and so like between 25 to 40 or 35, 36. So the younger generation, younger population.
Yes,
And
sir.
sorry,
I said yes, sir. Yes.
yeah. So I think slides are.
Yes, sir. Slides are visible.
Huh. So when we talk of diabetes, and I'm sure you must be thinking that why we are being invited to attend a webinar or like the discussion on the diabetes. And I'm sure out of all these people who are in this presentation, each and every one of us might be having one or the other family member suffering from diabetes, because the diabetes is a global epidemic. It is just, in fact, not only the diabetes but the diabesity. When we talk of diabetes, it's not only diabetes, it is diabesity. So the diabetes along with the obesity is achieved a global epidemic, or like even in the country we have we are having an increase in the number of population suffering from diabetes as well as the obesity, and the obesity is a major reason of diabetes. So when we see the numbers, and if we go by the numbers or the data, we have almost more than 70 million people suffering from diabetes in the country, and this number is increasing day in day out. Even the globally, even in any countries, the number of diabetes is increasing. And if we see the in India, just a year before, we were the highest, having the highest number of population suffering from diabetes, but now we are at the second position after the China, and this is because like they have the higher number of the population in their country. So why I'm saying, like, why we want to discuss it amongst you, that this is initially it was thought that the diabetes is a disease of the older population, or like of the after the 50s, of the 40s. But now what we, the scenario is changing. Even the people who are young, even the people who are in 25s, 30s, 35, what we see when I'm practicing for last 25 years, when we used to practice 15, 20 years back, we used to see the patients, those who are in their 50s. But now we are seeing the younger generation, younger population, maybe in 25, maybe in 27, maybe in 30s, they are coming with the diabetes. And it's not the type 1, it's the type 2 diabetes. So like the prevalence of this youth onset type 2 diabetes is increasing worldwide as well as in the country, because of the obesity, overweight, or the weight. So if we see the type, we'll discuss what are the different types of diabetes, type 1 and type 2. And if we see it's not only the prevalence of type 2 only, the prevalence of type 1 is also increasing. So type 1 as well as type 2 both are increasing. If we see the emergence of type 2 diabetes in pre-diabetes in youth, we see the number between the 20 to 39 years. You can see this number is increasing, and it's not only in the higher middle income group, it is increasing in all income groups. So like irrespective of age, irrespective of gender, irrespective of socioeconomic status, irrespective of your circumstances, the prevalence of diabetes is increasing day in, day out. And that is a worrisome, that is a problem where we need to work. And what are the different risk factors for type 2 diabetes? And if we talk of the children's or the adolescents or in the younger generation, that is obesity, weight, that is visceral fat, particularly your fat around the belly, or the belly fat, or the weight is major challenge, which is responsible for the insulin resistance. And this insulin resistance in turn is responsible for diabetes, because the obesity and the weight or the visceral fat increases insulin resistance, that doesn't allow your body's insulin to work properly. Then genetic predisposition. Suppose if your both the parents are diabetic, then the chances that 90% of the kids will develop diabetes in their lifetime. If out of both only one parent is diabetic, there are 40% chances that you'll develop diabetes in the future life. If no parent has diabetes, but you have a diabetes in the maternal or the paternal side, then definitely you have the chances of developing diabetes in the lifetime. Now coming to like the children who are born with a small for gestational age, or the newborn microsomia, diabetic, there are multiple factors, but the major factor is the lifestyle, because it is a disease of lifestyle. It is a metabolic disease of lifestyle, which can be corrected with lifestyle, which can be caused because of the lifestyle, just change in the lifestyle. So what actually you mean by diabetes? Can anyone from you tell me what he or she understands about diabetes, or what is his our perception about the diabetes?
Sir,
Leave
as
us
far
out
as
this scientific, Anji, sorry.
this side Abhishek.
Yeah,
Sir, as far as I know, when the body say in insulin which is created by the pancreas stop working or the pancreas working partially, then the absence of creating the excess of sugar in the body create the diabetes.
great, Abhishek. Thank you. So, Abhishek, as you have rightly pointed out, that the diabetes is majorly the increase of blood glucose or increase of glucose values in your blood. And why it happened? Because whatever we eat, be it carbohydrates, be it proteins and fat, whatever the food material we are eating, it gets metabolized to the smaller units. Like carbohydrates gets metabolized to the glucose, fats metabolized to the fatty acids, and proteins to the amino acids. And then these are absorbed from our intestine in the body to perform their duties. So the carbohydrates, they gets metabolized to the glucose, and this glucose reaches to the cells to provide energy. So we know that the cell is the smallest unit of our body, which functions as a complete unit. And for running this cell to its daily activities, you need glucose, because one molecule of glucose will provide 32 ATPs, which are the energy units. But on one side, we are saying that when the patient develops diabetes, he is having the weakness and all that. On one other side, we have learned from our school days that whenever you used to feel weakness, our mothers used to say that glucose pee lo 3 chammach ghol ke and you will be better. So this glucose in diabetes is not actually reaching in the cells. What happens? You have eaten carbohydrates, it gets metabolized to the glucose, and then for entry of this glucose in your cell, you need insulin. Let's understand in this way, like you have a cell, and on that you have a lock, and the key to that open that lock is insulin. When this lock will open, then only glucose can enter into the cell. So if the glucose is there, cell is there, but the lock is not opened by the insulin, glucose cannot enter into the cell and cannot be metabolized. That is the reason of diabetes. And then you have, as Abhishek has rightly pointed out, that the increase of the glucose will be in the blood, and when we check blood sugars, we find that it is raised. So it can be like either the lock is not open, it cannot be opened by the insulin, as we see in type 2 diabetes. Suppose there is a lock, but by virtue of suppose someone has applied some, say, like tape or something on the lock, so the insulin is there, key is there, but it cannot fit into the lock. So that's why the gate is not getting open, so the glucose is not entering in the cell. This happens in type 2 diabetes, and this tape or whatever you can say is a fat. So you have a cell, you have a lock on that cell, insulin is there, but because of fat, this insulin is not able to open that lock. That's the reason that this glucose is not able to enter into the cell, and patient is developing diabetes. This is type 2 diabetes, which we call as insulin resistance. And in patients who are having type 1 diabetes, beta cells does not produce enough insulin because of some autoimmune disorders or because of some disease. Beta cells get destroyed and they cannot produce the insulin. So there is no insulin. And in such case also, you develop diabetes. So like it can be type 1, it can be type 2. So like if we talk of type 2 diabetes, how many types of diabetes you all have heard? Anyone from you?
Sir, only two. The
Yeah,
type
yeah.
1
Which
and
one?
type 2.
Type 1 and type 2. Yes, very great. Any other? Another is gestational type diabetes, that the diabetes which we see in pregnancy. So type 1, as we discussed, it is usually in the kids where the pancreas gets failed, they do not produce insulin because of the beta cell destruction, but it accounts for only less than 5% of the entire population in the country or in the world. Whereas type 2 diabetes, which usually develops after 30 years of age, it is because of obesity, it is because of overweight, and this comprises 90 to 95% of the diabetic population of the country. Then you have a very small fraction of the patient, those who are having gestational diabetes in the females. So when they get pregnant, after 6 months of pregnancy, because of the insulin resistance, because of the hormones which are produced during pregnancy, these females develop diabetes. And this diabetes usually is self-limited to only pregnancy. Once they get delivered, then this diabetes in 90% of the patients get resolved. But in 5 to 10% of the patient, this persists even after the pregnancy. So these are type 1, type 2, and gestational diabetes. Then you have a very multiple different forms of diabetes because of the destruction of the pancreas, secondary forms of diabetes, then LADA, MODI, but we should not go into that detail. These are the major three areas where we can think of where in our common population, patients develop diabetes. And what happens in type 1 diabetes, as I was discussing, this is the normal situation. This is the pancreas, which is produce insulin, which acts as a key. This is the cell where there's a lock. This key fits into the lock, and finally glucose enters into the cell. And in the cell, this glucose gets metabolized to produce energy. But in type 1 diabetes, the pancreas is not working, so there is no insulin. Lock is closed, glucose cannot enter the cell, and finally it is moving into the blood, and you have hyperglycemia or increase in the blood sugar. Then what happens in type 2 diabetes? Normally, this was the same situation, but in type 2 diabetes, key is there, but lock is blocked. And this lock is blocked because of the fat on this lock, visceral fat or the abdominal fat on this lock. So the key cannot fit into the lock. And finally, the door is closed. Glucose cannot enter into the cell. And finally, this glucose is roaming into the blood, and patient is having hyperglycemia. So on the one hand, cells are not getting the enough glucose, so like they are deprived of the glucose, they are deprived of energy, so patient used to feel weakness, lethargy, numbness, tingling, weight loss. And on the other hand, this glucose is roaming around in your blood, creates predisposition to the multiple infections, reduces your immunity. And we are seeing in the COVID times, like all the patients who were diabetic, they were very getting the severe disease of the COVID, because any rise in the glucose in the blood predisposes the patient to the lower immunity and for any infection. You must have heard that in diabetic patients, the infections are very common, and even the delayed healing of the infections of the wounds is common. So this is gestational diabetes, where it occurs in the pregnancy. And what is the major etiopathogenesis? So if you talk of the type 2 diabetes, I'm sure you all must be thinking that why I must be listening to this, because I'll not develop diabetes. Any one of you think that he will not develop diabetes in his lifetime or a lifetime? And the reason for that? Hello? Any one of us can be sure that he or she will not develop diabetes in his lifetime?
No one can. So
No one can. Why?
No.
Why?
sometimes it depends upon our like hormonal disbalance and our like sometimes our genetical disorders, and also this can be happen with any stage, any time as well in the life.
Yeah, Yogita.
Increase of non-physical activities.
Yeah. So Yogita and English, yes, very rightly pointed out. But let me tell you very frankly, we as an Indian, we as an Asian genes are predisposed to diabetes at any point of time. By virtue of our ethnicity, by virtue of the genes which we have inherited from our parents, particularly the Indians and the Asian genes, this is called a thrifty genotype. So in spite of the best exercise, best lifestyle, still you have a risk of developing diabetes, because we are genetically predisposed. So this is like we call it the father of diabetes, Elliot P. Jocelyn. We have a very big institute of Jocelyn Institute of Diabetes in US, and it is written on his like that institute's front gate. Genes load the gun. Genes load the gun, and environment pulls the trigger. Getting my point? So we are genetically loaded. The only weight is of environment. When we develop physical inactivity, we develop mental stress, we get weight, and we deviate from our lifestyle, we deviate from the healthy eating pattern, and we develop diabetes. So we are all are genetically predisposed, be me, be you, everyone in this country, in the Asian region, by virtue of our genetics. So like it is a genetic predisposition. On the top of that, if there is any slight deviation from your healthy lifestyle, you develop diabetes. And that is the reason, because like we see in the corporate, we see in the employees, the stress is there. Mental stress is a very important reason for developing diabetes. Anyone can tell me how mental stress can lead to the diabetes? Any suggestion? So when we develop, when we have a mental stress, there is a hormone or the cortisol, named as cortisol, which gets released in our body. And this cortisol hormone, which helps us in tackling that stress, is causing insulin resistance. It is not allowing insulin to work properly. So that is again a mental stress is a very important cause of developing diabetes. Lifestyle, yes. So nutrition, diet, change in the diet, fast foods, high caloric diets. In fact, like our culture of the like one burger, one Coke free, this is combo meals, this meal, that meal. We are taking high portion of our meals. Whatever we need from it, we are eating much higher, and that is causing weight gain. Then on the top of that, physical inactivity, as I'm seeing that you all are from the corporates. So we have a 6-hour, 8-hour sitting routinely, isn't it? We are sitting on the chair, we are sitting in front of our laptop 6 hours, 8 hours. So like I'll suggest you should follow 20 by 20 by 20 rule. After 20 minutes, get up for 20 seconds, walk for 20 steps, then that will help you because we can't expect they're going for a like exercise during the time of our office. We can do it in the morning and evening, but yes, in the office you can do this small hack 20 by 20 that will help you in increasing the fidgeting or increasing the calorie burn. So there are multiple things, so multiple reasons, or we can say that. So when it comes to the pathogenesis, this is the external criteria, like we are having a unhealthy lifestyle, we are not doing exercise, we are sedentary lifestyle, our eating is not, and this all results. This is a very busy slide, and you can, this is in the body level where what is happening. So like from the pancreas, beta cells are producing less insulin, alpha cells are producing more glucagon, your glucose is reabsorbed more, there is a decreased glucose uptake in the muscle. So there are multiple pathogenesis which are taking place in the body, and the ultimate result is that you are developing diabetes, your blood sugars are high. So if we define the risk factors, what are the two types of risk factors? One is modifiable and another is non-modifiable. So what are the non-modifiable? That means we can't do anything for these risk factors. These are non-modifiable. We can't change them, like age. So as we progress in the age, chances of developing diabetes are more. First degree relative, as we discussed, if the parents have diabetes, the chances of developing diabetes are more. Then the ethnicity, if you are from the Indian and Asian origin, definitely you have a chances of developing diabetes more. If you have impaired glucose tolerance, if any female had a history of gestational diabetes, delivering of heavy weight, females or the girls with the PCOS, altered menses, then if it is a small test which you can do right now also. If you have this type of marker in your neck, this is called as acanthosis nigricans. Can you see this?
Yes.
This marker, usually what we say, मैंने chain पहना हुआ था उससे हो गया था. This was because of the gold chain, this was because of the dhaga, or whatever we have in our neck. So we usually attribute it to that, but it is not because of that chain. It is not because of that dhaga. It is because of the insulin resistance. So these black markers, if you have in your neck, if you have in the knuckles, if you have on the knuckles, if you have on the elbows, that this is called as acanthosis nigricans, and this is a marker of insulin resistance. So, and this is the indication of that you might develop diabetes in coming years. Then what are the modifiable risk factors? The dietary factors. Yes, you can change your diet. Yes or no? Can we change?
Yes, sir. Yes, sir, we can change.
Yeah, we can reduce our abdominal obesity, we can reduce our weight, or we can increase our physical activity. So if you have a waist circumference of more than 90 centimeters in males and more than 80 centimeters in females, can you get it? 90 centimeters in males and 80 centimeters in female, then you are having a risk of developing diabetes. That is called as visceral obesity or the more visceral fat. So what are the classical signs and symptoms of diabetes? Any idea?
Yes, sir.
Classical 3P: increase thirst, increase hunger, and increase urination. And now we don't, many of times we don't see these characteristic symptoms. The patient usually come with the weight loss, with the lethargy, pain in the legs, weakness, numbness, tingling, frequent infections, frequent urogenital infection, urinary infections, cuts, fungal infections, even the slow healing of the wounds, numbness and tingling in the hands and feet. And some patients, they come with the blurred vision. And the research and the data show that almost around 40 to 50% patients, they are not diagnosed at time. And because it is a silent disease, so they come with the complication. Whenever they get diagnosed, they are already developed some complication. So now the recommendation that after 30 years of age, every person should get their blood sugar test done at least annually. And if you have any symptoms, get it more frequently. If you have a family history, get it more frequently. If you have any symptoms suggestive of insulin resistance, get it more frequently. So the blood sugar test should be done at a frequent intervals. So this is about diabetes. Like, ठीक है, sugar बढ़ा हुआ है, सबको ज़्यादा है, हमारे blood में sugar ज़्यादा है. But why should we treat it? Why? हमारी बला से क्या फर्क पड़ता? बढ़ा रहे. Let it be. In fact, when as I was saying, that when we feel weakness, usually people what does? They do that, they take just 3-4, like usually in our school days, when you used to go for an exam, or when we used to feel tiredness, our mothers used to give 3-4 spoonful of the glucose dissolved in water, and we were happy and we were energetic. So in fact, glucose पीने से तो energy आती है, तो why? Blood में तो glucose खूब सारा है. Let it be in diabetes. We must feel more energetic. So why we are concerned about treating diabetes?
Right, sir.
So why it is so that the patients who are having high blood sugars are having weakness, whereas we used to feel energy after taking glucose. So it's a similar thing. Like suppose if you have a car and you have a petrol filled in a tank of 5 liters and keeping it on the seat, and then you are saying the car is not moving. Why it is not moving? Because like the petrol is not at the place where it should have been. It should have been the tank, not in the seat, in a can. So same in diabetes, like your blood glucose should be in the cells to provide energy, not in the blood. And if it remains in the blood, what it will do? It will damage the major organs, major vital organs like eyes. So let me tell you that diabetes is the most common cause of blindness, preventable blindness. Diabetes is the most common cause of end-stage renal disease. Diabetes is the most common cause of renal failure. Diabetes is the most common cause of neuropathy. In diabetes, you have an increased risk of heart attacks and the paralysis or stroke 2 to 4 times. It is a major cause of amputation after the lower limb amputation or the amputation of the legs after the accidents. So it is a serious disease, but it doesn't seem to be, because it just seems to be a very silent sort of disease. So we should be very cautious. We should be keeping in mind that it can cause our devastating features or the devastating complications. And if we talk of the what is the level where we decide that this patient is diabetic or not diabetic. So any person who's having a blood glucose in the fasting of more than 126, or after the meal, or after 75 grams of glucose more than 200, chances that the patient is diabetic. Or there is a test which is called as HbA1c that represents blood glucose level of last 3 months, and if it is more than 6.5%, then the person is diabetic. So any fasting, any blood glucose values in the fasting is more than 126, patient is diabetic. And if it is between 100 to 126, it is impaired fasting glucose or pre-diabetes. So initially the up to less than 100 in the fasting, up to less than 140 in the postprandial or 2 hours after the meal is normal. Anything beyond 100 and 140 is either pre-diabetes or diabetes. So how do you identify this population? There are multiple risk scores, multiple scores or multiple things wherein you can assess that you can identify the patient who are at high risk, particularly like the obese, overweight, acanthosis, or family history or sedentary lifestyle. You can find out this patient is at risk of diabetes. And to manage diabetes, you have all non-pharmacological and pharmacological management. I'll not go much into that because we'll talk on the prevention. So in the non-pharmacological therapies, you have a medical nutrition therapy, physical activity, weight loss. Weight loss is the major challenge. This is a dietary recommendation for everyone. It's not for diabetic. Every person should have the composition of this type, like the carbs in your daily diet. What are the calories you are taking in your daily diet should not be more than 50 to 60% from carbs. And but what happens? Any one of us, we are chapati eater, we are rice eater. So we eat more of carbs from the breads, from the carbs, from the cereals. So we take more of carbs, and that is the cause. That is responsible. And I'm sure if you all will calculate your daily protein intake, you will find that it is not up to the mark. So suppose Abhishek is 70 kgs, he needs 1 gram per kg body weight. So he needs 70 grams of the proteins per day. But I'm sure if you check, if you're a vegetarian, because I can see if he's a vegetarian, definitely we cannot achieve that much of protein intake from our normal diet. Because like we have hardly 3 grams or 4 grams in one chapati, 3 grams and 1 katori of dal. Or even paneer, if you eat paneer also like 100 grams or 200 grams, you get only 10 grams of protein. So we are less in the protein, more in the carbs. And the research has shown that this protein intake, if it is less, it is inversely proportional to your belly fat. So if you're less protein intake, you have more of belly fat, you have a more protein belly fat. So these are the macronutrients like the carbs, fat, and protein. So the carbs are the main source of energy. So we should consider that what amount and source we should consider taking the carbs. Complex carbs like whole wheat flour, and these should be preferred instead of the refined or the maida or such type of carbs. We should avoid the high carb foods. Then the fats. This is again a very, very discussed point that which oil I should use, which oil I should not use. So I think
can everyone please?
If we come to the macronutrients like protein, they provide amino acids, help to build muscle mass. Like we can get it from the animal sources, we can get it from the plant sources, and 1 gram of protein provides 4 kilocalories. So ideally, it should be at least 0.8 to 1 gram protein per kg body weight. They should provide 10 to 20% of the total energy per day. Animal proteins often high in fats, especially saturated. So like we should prefer the vegetarian proteins, and we should get enough amount of protein so that we can have a good healthy muscles. So this should be your healthy eating plate. It's not for diabetic, it's for everyone. That your plate should look like that. It is filled of vegetables, then it is the fruits. So like half of the plate is with the vegetables and fruits. And let me tell you, WHO recommends that if you are taking 400 grams of fruits and vegetables, 80 grams, 5 servings, or whatever it is, 400 grams of fruits and vegetables in a day, you'll get enough of vitamins, minerals, and micronutrients. So you do not to take any vitamin. So your plate should look like this. Then you have a whole grain and the healthy protein. So this your plate should, and drink water, tea, or coffee with little or no sugar. Limit milk and dairy, like 1 to 2 servings. And so we should be very cautious that in what is a look in our plate and what we are getting from that, like whether it is carb, whether it is protein, whether it is fat, and vegetables and fibers, whether we are getting or not. Exercise, yes, I'm sure you all must be usually going for the gyms or the exercise. You all are quite young, so must be going for a gym. But minimum 30 to 45 minutes of exercise is recommended. It can be a brisk walk, it can be a jogging, it can be cycling, it can be cardio. You can go for a 5 days of the aerobics, 2 days of anaerobics. So like you can go with the different permutation combination of the exercise. We all know the benefits of exercise, but in diabetics, it helps in increasing the density of insulin receptors. So this will help in reducing the insulin resistance. Types of exercise, you all know that these are aerobic, resistance, and flexibility. So like aerobic exercises, they use large muscles, can be performed safely. They are better in the type 2 diabetic patients, like the walking, cycling, swimming, running. Then you have resistance exercises like for the muscular strength. So for the quite young people, weightlifting, push-ups, pull-ups, and all these gym instruments. For the older population or for the people who cannot do this much of exercise, you can go for the flexibility or the bends, the yoga and stretching. And recommendation, minimum 45 to 60 minutes or 30 to 45 minutes minimum exercise at least 5 days in a week we should perform. Then you can, if you are not able to do this much of exercise, even you can do yoga, which will help in reducing the mental stress, helping the stretching of the body and the flexibility of the body. As far as the management of diabetes, yes, this is part is asked as a doctors. We have a multiple medications, but many of the patients, they come to us and they say that we don't want to take medication, we want reversal. And reversal is usually possible in the younger people like you, when you recently develop diabetes, when you are overweight or obese, when you have good C-peptide level, when you have a good pancreatic reserve, and if you're energetic and enthusiastic, that I define with the acronym A, B, C, D, E, F, wherein A is for age, B is for body weight, C is for C-peptide, D for duration of diabetes, and E for energy. So, and F is for friends and family support. So by this, you can prevent, we can reversal, or what the remission is a better word. So you can keep your diabetes in remission and you may not need the medication. There are multiple medicines that are available which acts at the different parts of the body. And the ultimate aim is to control the blood sugar. For that, we should be doing monitoring, frequent monitoring, monitoring your blood sugar in the fasting, monitoring your blood sugar in the postprandial, and your fasting blood sugar should be around 100. Postprandial blood sugar will be around 140, and the HbA1c should be less than 7. So I think this is just a brief about the diabetes, and the topic is open for discussion. We know that we are getting an epidemic of diabetes, and it is a disease which can be prevented, which can be delayed, which can be postponed just by taking a healthy lifestyle measures, by just having a good knowledge of that what we are eating, how much calories we are burning. And if we know our ideal body weight, definitely we can prevent diabetes or we can postpone diabetes. And this is just iceberg phenomena. What we are seeing is just a tip of the iceberg, wherein we know that because we don't have any registry or the official registry in country wherein we have the data of the patient, but this number of the diabetes, though we say we are only 70 million, but this number is much higher than what we say. So thank you very much for the patience hearing, and the topic is open for discussion.
Hi, sir. Abhishek this side again.
Yeah, Abhishek.
Sir, I am from Agra and working in working with Walking Tree Technologies.
Sorry?
Sir, I working with Walking Tree Technologies,
Okay.
IT service company. Sir, my diabetes was prescribed in last year 2021 suddenly, and
2015.
2021.
21. Okay.
Yes, sir. And sir, I am on insulin. And suddenly sometimes my sugar level goes to 500, 600. And parallelly, sometimes my sugar level goes to 40 to 50 only.
Abhishek, you said that you are only 25 years of age, huh?
Yes, sir.
And what type of your diabetes? Have you done your C-peptide test done and integrated antibodies done?
So, no, yet, but I consulted my doctor and he said that I have type 2 diabetes.
Whom he consulted in Agra?
Yes, sir. Sir,
Whom you-
Dr. Prabhat Agrawal.
प्रभात अग्रवाल इज अ वेरी गुड फ्रेंड ऑफ माइन. नेक्स्ट टाइम आप जाओगे तो बोलना मैं डॉक्टर नवनीत से बात की थी.
Okay,
Dr.
sir.
Prabhat Agrawal is a very good friend. So basically, if you say type 2 diabetes, I think you should get a. What is your weight?
Sir, I lost 4 kg from last year, and my current weight is 51 kg.
So I think Abhishek, you should get a C-peptide test done. If you are on insulin, if you are losing weight, and you must have started insulin because considering that you might be LADA or a type 1. There is another category of diabetes between type 1 and type 2, that is type 1.5, or what we call it as a LADA. That is a latent autoimmune diabetes of adult. And that in that case, you need insulin therapy. So get a C-peptide test done. If C-peptide is low, then definitely you need insulin. And now you said that you are having sometimes hypos and sometimes hyper. So that is maybe because of that your insulin therapy is not properly titrated. Because like in type 1 diabetes or LADA, what we need 4 times insulin. One is the basal insulin, and the other is the before breakfast, before lunch, and before dinner. Let me tell you why. Because in the normal people, like I consider that many of you must be non-diabetic, we secrete 1 to 1.5 units insulin per hour. And out of that, 50% of insulin is secreted throughout the day, and rest 50% is secreted along with the meals. So you need to, you're on the 4 times of insulin, Abhishek?
Sir, I have 2 types of insulin, 25 units.
That's the reason, because if you're taking this 2 times of the insulin, that is causing hyper. If so, get your C-peptide test done. If it is low, go for 4 times of insulin, that is 3 times bolus and 1 time basal.
Okay, sir. So, sir, it's reversible possible with the help of
Abhishek,
exercise?
in your case, yeah, absolutely no, because like you are already on insulin, your must be, that is the reason why I've said A, B, C, D. C is for C-peptide. If C-peptide is normal, then it can be considered reversal, remission, whatever it is. But the C-peptide is low, that means reversal is possible only in type 2 diabetes, not in type 1 or not type 1.5 or LADA.
Okay, sir.
Hello, sir. Hello.
Yeah.
Hello. Yeah, this is Surendran from Bangalore. So I got diagnosed at now I'm 33. I got diagnosed 2 years before. So I'm taking metformin now. I'm in control. So after food it is 160, 170. Before food it is 90, 100. So how can I control myself? Or metformin, any long time side effects will be there?
No, in fact, like many of the people, those who are now seeing on the Facebook and the social media, they are saying that the metformin has a multiple side effect. We should not take this, or just to get the attention. There is nothing like that. Metformin is a time-tested drug we have in the market for the last 40 years. And let me tell you, metformin reduces insulin resistance. Metformin nowadays is used as an anti-cancer. Metformin is used for anti-aging. Metformin is used for the regularization of the periods in the girls with the PCOS. So metformin you can take for a longer period of time without any side effect. Metformin is safe.
Sir,
Thank you, sir. And one more question. And
Sure.
I have a muscle weakness and so is it because of diabetes, vitamin B12 and vitamin D? So I have muscle weakness and I'm getting mostly cramps and everything. So is it because of the diabetes or how? Under my diet, I'm in control.
Yeah, so like this muscle weakness, what we call as an adult kwashiorkor, you must have heard initially there was a disease. So this muscle weakness, as I discussed, it is because of the less protein intake. So it is either vitamin D deficiency, you have a muscle weakness, and if you're not taking enough amount of protein, then definitely because like muscles gets regenerated, or like the muscles gets proteins for its strength, for the healthy muscles. So if you're not taking enough of protein, definitely you'll get a generalized fatigues, aches, muscle weakness. One. Second thing, if your sugars are high, then again, you might develop muscle weakness or the fatigue. So check your blood sugars or the HbA1c. Get a good protein diet. If you're vitamin D deficient, take vitamin D supplementation or the vitamin B12 supplementation.
Hi, my name is Lokesh.
Yeah, Lokesh.
How to avoid pre-diabetes? Like my parents have diabetes. Maybe I may also get if it got detected like pre-diabetes, it will compulsory. It will change to diabetics or not?
Okay. So, Lokesh, in 5 years, almost more than 50% of the people who are pre-diabetic, they progress to diabetes. And diabetes in the pre-diabetes stage is definitely 100% reversible. So you have rightly pointed out how to prevent pre-diabetes. Yes, you can prevent pre-diabetes by coming to the ideal weight. Someone has asked like, what is my ideal weight? Ideal weight. So let me tell you that there are multiple formulas. You can calculate your BMI, body mass index, and if it is more than 23, you are overweight and obese. If it is more than 25, you're obese. And other than that, just a simple formula: your height in centimeter minus 100. Height in centimeter minus 100. Suppose like you have a height of 175 centimeter, minus 100 is 75. So 75 is your ideal weight, just an approximation.
Okay.
Suppose if you are 85 kgs and your ideal weight is 75 kg, you should lose these 10 kgs. If you lose these 10 kgs, definitely you will prevent the diabetes, or you will come to the normal from pre-diabetes to euglycemia. So you can halt the progression of pre-diabetes. You can come to even normal.
Okay.
By just
Coming to
sorry.
Coming to normal is see what my question is like. Whatever you said, I'm okay with that. The question is like, see, the pre-diabetic can go to normal stage, right? Any stage,
Yes,
like
yes.
follow like it is not compulsory. You will get some.
No, it's not
at some
compulsory.
stage.
Definitely, if you work in a good way with a healthy lifestyle, definitely.
And also like I also seen like give me 1 second, please.
Sorry.
Sir, I had a question.
Yeah.
Sir, actually, my mother was a diabetic patient. I got COVID 2 years back. And after I got COVID, I got some kind of blisters in my body. When I went to the doctor, they told me it's because of your sugar and there's sudden hike in sugar and all that. That your sugar was around 400. So post that, I took a lot of medications and all, and now things. I'm a Bengali, so my entire diet changed. Like I was supposed to give up rice and all, and now I have started depending on jawar and bajra, things like that. So do you think, sir, these kind of change in dietary habits, can I get rid of diabetes, or is it like I have to be on medication and these kind of diets permanently and not be able to enjoy the phase that I had before?
So let me tell you that if you're a Bengali and if you want to enjoy rice, definitely you can enjoy rice. So like what I'll suggest, there is nothing, no food, zero carbs. So if you want to take rice, take small amount of rice, add more of vegetable in that, and definitely you can enjoy that rice. Instead of going for a higher portion size of rice, add more vegetable in that. So that will reduce the glycemic load. One, you can take millets, jowar, bajra, whatever you're taking the millets, they are good because like they're low in the carbs. So it's not necessary that in a lifetime you can't take rice. You can, but add some more of vegetables, so that will reduce the glycemic load of that food. One. Second thing, as you said, that depending on the medicines, or like you have to take the medicine lifelong, that all depends that what is the status of your pancreatic level. If your C-peptide is normal, if your weight is high, then definitely by reducing weight, by reducing insulin resistance, you can reduce your number of medication, or you can be off the medication. But that all depends. That depends from person to person. There is nothing blanket. If you see on the social media, every other company is offering you reversal without asking anything. Just a marketing hack like reversal. Reversal a very, very catchy name. Everyone is asking for reversal. Hoga nahi hoga, God knows. So, but you should be very cautious, because like there is a very clear-cut guideline. This patient can go in reversal. This patient cannot go in reversal.
Sir, wanted to ask another question. So for protein, you said that we have to have a higher amount of protein that actually helps. So when I speak to few people, they tell me I'm a Bengali, I'm already on fish and meat and things like that. So but still there are few people who suggested me D protein powder, which is had. So is it? Do you also advise that I should have these kind of things?
I'll suggest, if you want to take a good protein, go for a natural protein. These supplements are for those people, those who cannot eat food. If you can take the good quality of paneer, dairy products, fish, you can get natural protein from these things. Soya bean, grams, quinoa. You have multiple food items with good amount of protein.
So, doctor, in
Thank you, sir.
continuation to that, for a vegetarian, will dal be enough source of protein?
No, dal 100 grams of dal contains only 3 to 4 grams of protein. So like then
Correct.
you can have chana, you can have soybean, quinoa, paneer, dairy
All right.
products.
Okay,
Then
but you
will get
would
up in the
never
amount of whey protein.
recommend for a vegetarian to have whey protein?
Yeah. So like you can have from the like the casein proteins from the dairy products, from soya, from the
Okay.
paneer, and from the quinoa.
Got it. Got it.
Okay.
But not the supplement, ideally.
No, you can take supplement. I'm not against the supplement, but if
Okay.
you can complete it from the natural sources,
Natural would be the best option.
yes.
Right.
Hi, I'm back, Lokesh here. Yeah, my question is like, if it is showing pre-diabetics, then we need to stop completely eating sweets.
Lokesh, it depends on like if you want to lose weight, definitely you should reduce carbs. And sweets are again carbs. So it's not only sweets, basically sweets are concentrated carbs. So
If
it's
you
not-
are in the same, if you are in the right weight, then in this case we can take the sweets or no?
No, right weight. If you're in the right weight, so you should know that what is the daily calories. Suppose like if you are 60 kgs and you need to get 1800 calories in a day. Let me tell you the calorie count. And so you need 15 to 1800 calories in a day. You know,
Mm.
medium size double cheese margherita pizza is
Mm.
1600 calories. So that means the total amount of calories which you require or need in a day, you are
Mm.
just taking in that one pizza. You've taken your breakfast, you've taken your lunch, and now on the when you went to the mall, you've taken one pizza. So now you've taken the entire like more than 3000, 4000 calories in a day. Same way for sweets. Sweets are concentrated carbs, concentrated calories. People have a mind that I can't sweets, but like suppose if you're not eating sweets, but if you're taking much of rice, much of carb containing food, then again you are doing bad.
Okay.
Not
Okay.
just absolute sweet, no or sweet. If you are just cautious about your calories,
Mm,
you
mm.
can take a small amount of sweet, but take a very, very small amount.
Okay. Okay. Got it. Thank you.
Hi,
Good
sir.
evening.
Abhishek again. Sir, like as I said, yeah, I have. Sir, there's a possible to reduce my diabetes apart from the insulin.
Abhishek, again, I'll suggest that you should go for a C-peptide and integrate antibodies.
Okay, sir.
That only decide. Abhishek, I'm based at Gwalior, and you can connect with me anytime. Don't even if you go to the Pravat, I can talk to him.
Okay, sir. Thank you.
Okay, but get your
Navneet sir,
C-peptide and integrate
Madhumay,
antibodies, and that will answer your all queries.
Madhumay
sir.
here
Thank
from
you.
Ahmedabad. I wanted to ask you, in the month of October, I had HbA1c concentration at 6.6.
Mhm.
Within 2 months, it got back to normal, 5.4 HbA.
Great. Hmm.
Perhaps some problem in terms of tests might also happen because I tried doing HbA1c test 2 times and it was different with different lab technicians. So one time it was 7.1, one time it was 6.6. But after 2 months, when I did it with a private firm about Tata 1mg, I was taking medications for 2 months and then and a lot of exercise, my weight also came down to 67 kgs, which is in the range. Then I got, after 3 months, I got the HbA1c content to 5.4 month of January. So and my diet and everything is completely constant. So what are the chances that I should get into the HbA1c test once again after a few months, or I should, because I'm not on medication now.
Great. So like you will stop the medication and your A1C is less than 6.5, that is fine. So you should get your A1C done every 3 months. But there is a caution. You should check your blood sugar at least every 15 days or every month. Don't wait for A1C for 3 months. Because like once you'll wait for 3 months, you get an A1C of 7.5, then you are already wasted 3 months. So get your fasting TB done every 15 days. Get your A1C done at 3 months. If your A1C is more than 6.5, you are diabetic. If it is between 5.7 to 6.4, you are pre-diabetic. So if you can maintain it in the pre-diabetes or even in the normal range with diet and lifestyle, definitely you don't need medication.
Okay.
Yeah.
5.4 and 5.5 and less, are there chances of getting into pre-diabetic stage once again?
Yes, definitely. If you not follow the good lifestyle, definitely you can again develop it. So like that's why I'm saying diabetes is not reversible. It is in remission.
Okay.
So if you maintain the lifestyle, you are in remission. Once you leave the lifestyle, you'll again get to develop. It can come back anytime.
Yeah.
Good evening, doctor.
बात कर रहा हूँ अहमदाबाद से। सर मैंने मेरा क्वेश्चन चैट बॉक्स में डाला है, एक बार वो भी देख लीजिए।
और ये मैं ये
Can
जानना
you repeat
चाहता
your
था,
question? Because like there are multiple questions coming in the chat box.
देखो जिस नलिन, आई एम फ्रॉम अहमदाबाद करके होगा, मैंने उसमें डाला है। मुझे ये जानना था कि जो मार्केट में बहुत सारे लोग हमको बोलते हैं कि आयुर्वेदिक डॉक्टर्स या आयुर्वेदिक दवाइयाँ भी है, जैसे गिलोय है, आप उसका सेवन करो, फिर
गिलोय है,
तो
नीम
वो
है,
कितना
करेला
हेल्प
है,
करता
जामुन है, मेथी है।
है, वो कितना हेल्प करता है सर, और कितना इंटेक में?
आयुर्वेदिक में हमेशा हर प्लेटफॉर्म बोलता हूँ, कोई भी पैथी खराब नहीं है, बीट आयुर्वेदिक, बीट एलोपैथिक, बीट होम्योपैथिक, बस वो आपको इफेक्ट पूरा आ रहा है। आप करेला, मेथी, गिलोय जो भी लेना चाहते हैं, प्रोवाइडेड इफ यू टेकिंग दिस एंड योर ब्लड शुगर्स आर इन कंट्रोल, fasting less than 100, TPG less than 140, you can follow that. Because like all these indigenous medicines, methi, karela, giloy, jamun, gudmar ki patti, there are multiple things which are available, and they all help you in at some point of time and some metabolism. But for the people who are in 300, 400 or A1C of 8, they are not effective. The people who are in the border range, they might help. But you should not be just assured on these Ayurvedic medicine. You should keep on monitoring. And if it is not working, don't wait. Go for allopathic medicines. Let me tell you that in diabetes, the complications are because of hyperglycemia, not because of the medications.
सर मेरा क्वेश्चन था, मैंने लिखा है तो मेरे को थायराइड है, जो वेट मेरा कम नहीं हो रहा है ज़्यादा, टाइप 2 डायबिटीज है, उसी बेसिस पे मुझे हाई बीपी भी रहती है और मैं कार्डियक पेशेंट भी हूँ। तो ऐसा कोई सप्लीमेंट हो सकता है जो मुझे वेट लॉस में हेल्प कर सके?
आपका मैंने देखा वेट 90 kg आपने लिखा है। यस, डेफिनेटली डायबिटीज की बहुत सारी दवाइयां ऐसी हैं जो कि आपका वेट लॉस में आपको मदद कर सकती हैं, जैसे SGLT2 इनहिबिटर क्लास ऑफ मेडिसिन है जो हार्ट के लिए भी अच्छी है, जो कि भविष्य में आपकी किडनी और हार्ट को खराब होने से बचा सकती है, आपको वेट लॉस में मदद कर सकती है। GLP-1 एनालॉग्स हैं। सो डायबिटीज की मेडिसिन में ही थोड़ा सा परमिटेशन कॉम्बिनेशन चेंज कर दिया जाएगा तो डेफिनेटली यू कैन लूज वेट।
गुड इवनिंग डॉक्टर।
या गुड इवनिंग।
व्हाट्सएप नंबर या कुछ यहाँ पे छोड़ दे तो सर हम।
Are you there?
Yes, doctor, I'm there.
हमारी टीम से someone will contact you. No issue. No issue.
Okay.
Yeah.
Good evening, doctor. Actually, a very wonderful session. You have given a lot of awareness about this diabetics. Actually, there are a lot of things actually new for me. Actually, what you have told that neck related, actually that acanthosis, Nicron and obesity. Actually, I have this all the things, and even my family background also. My father having diabetics. So as of now, I don't have diabetics, but what are all the prevention things I need to take it?
You should lose your weight, and let me tell you, like if you have acanthosis and if you lose weight, if you come to your ideal weight, that acanthosis will fade. Otherwise, you apply any cream, even if you rub it, if you're anything you do, this will not go. But if you lose weight, this will fade out. So attain your ideal weight, lose weight by the exercise, diet, whatever you can maintain, and definitely this will help in preventing diabetes, because like you have a strong family history, so chances are there, but you can postpone the development of diabetes.
Noted. So your suggestion to reduce the weight mainly.
Yes,
I have to focus.
yes. And weight is, let me tell you, we never calculate what are the calories we are taking. We are doing munching, we are taking snack. As I said, a single pizza is 1600 calories, and you need these 1600 calories an entire day. You've taken a breakfast, you've taken a lunch, and then when you went to the mall, you've taken a pizza with a Coke. So you've taken more than 2000 calories. Yeah. You never know. Like even so, like suppose a single samosa, it is 250 calories. And research says if you're taking 100 calories extra from your desired caloric requirement of a day, you'll gain 1 kg weight in a year just by 100 calories. And you know, you need minimum say like 20 minutes of walk on the treadmill with 6 kilometers per hour to burn those 200 calories.
Noted. Because I am getting sometimes kind of tiredness and in leg also muscles pain and all those things.
That may be because of vitamin D deficiency and again protein deficiency.
So for that, I have to take any medicines or something for vitamin D?
Not necessarily. You just check your blood vitamins test done, vitamin D and vitamin B12 test done, and improve on the diet and maintain adequate hydration. Hydration again is a challenge. We don't take enough of water, and that causes leg pains, leg cramps, and non-muscle weakness.
Okay, thank you. Thank you, doctor.
Good evening, doctor.
Yeah,
Ashu this side from Chandigarh. Sir, if I want any consultation from you for my diabetic treatment, how can I connect you?
Umeed will contact with you.
Yeah,
Where you stay in Chandigarh?
in Jirakpur.
Okay, Jirakpur. Because I have done my MD from PGI Rohtak.
Yeah, great, sir.
In some point, sometime Chandigarh. So like Umeed will contact you for that. We have
Sure,
a
sure.
care program. So basically we run a complete care program wherein, because like what we see that when you go to a doctor, you just go for once in a month or once in 2 months. Then there are multiple questions which gets unanswered. There is
Yeah.
no one who is looking after you. So like we have designed a care program, which is a 3 months care program, wherein we have a dedicated health coach or a dietitian allotted to you 24/7. There is a doctor consultation. Along with that, medicines are included in that package, and that's only 1,200 rupees a month. Not a big deal. So what we have designed a very affordable, accessible program wherein you'll get a medicine consultation along with the health coach. Because like major challenge in diabetes is the awareness. It's not just medication. Medications are just to support or to control your diabetes. But if you can correct your lifestyle, you can prevent this disease. You can keep your diabetes in remission by just a healthy lifestyle, because it is a lifestyle disorder.
Yeah, actually, I'm taking Teneprid M 500 plus 20 mg
But it's
on
still
daily
not
basis.
controlled. We can change it. Someone has asked
Yes,
about the multivitamins. Multivitamins supplements you really don't need if you're taking a healthy diet. As I said, WHO recommends if you're taking 400 grams of fruit and vegetables in a day, you are getting enough amount of vitamin minerals in that. But still, if you're not taking, then you can take, and if you have a vitamin deficiency. Someone has
Thanks,
asked
doctor.
how to know more about that program. Umeed, you just pitch in your number. Umeed is there from our team. We are from the Beto. We are a biggest diabetes care company, and Umeed will contact you all to provide the details about our program.
Sure, doctor. Thank you
If
very
you're
much.
there, you can just talk about Beto and your program. And also I've added the link for the glucometer kit.
Yes.
You guys can click on the link and access that.
So I also wanted to add something. Doctor, am I audible?
Yeah, Umeed, carry on.
Okay, so this is for everybody present in the call or the webinar. So I have shared my number here in the chat box. I am sharing it again. If anyone wants to have a, let's say, consultation, online consultation with Dr. Navneet, I will be more than happy to schedule it for you guys. You can reach out to me on the given number in the chat box.
And we have
hello,
a complete,
doctor.
it's not only a one consultation meal. Let me tell you, because like suppose one consultation, you must be going to wherever, like you're in Bangalore, you're in Chandigarh. But again, I'm saying the diabetes is not just a consultation or just a medicines. It's the lifestyle. For that, in our care program, we provide a KO coach who will be taking care of your diet, the exercise, like she'll be advising you. And this is all on the online. This just through an app. When you can do a doctor consultation, you'll get a medicine delivered at home, and the coach, who is a dedicated coach for you, she'll help you in that what should be your caloric intake, what should be your protein intake, what should your diet look like. I said, so I think we are with the.
Yes, so we are at the end of the session. I think most of the questions have been answered. In case there is anything, Umeed has dropped the number. You can contact him on that. I'll just drop again the message so that you can connect with him in case you want to have a consultation or you want to know more about Beto as well. You can directly contact with Umeed here. And thank you so much, Dr. Navneet, for giving us a wonderful session. I'm sure that most of the people here has gotten a great insight on the diabetes and more on that.
Someone is from Gwalior. I think he has asked like from where I am in Gwalior. So Gwalior is a very small place, but I stay in front of a middle college in the Lalitpur colony, and everyone knows me in the small. It is a small city, so you can like this Mr. Mulayam Singh. I think he is from Gwalior only, so you can contact anytime.
Yes. So in case you want to consult him, you can do that. And also I've dropped a link for the glucometer kit, and you get a 25 strip and 25 lancet with that. Along with that, one free diabetologist consultations as well. You can just click on that link. You can also use a coupon code that is given below. And I hope you had a great session. Thank you so much, everyone, for joining. Thank you so much for Dr. Navneet for taking the session with us, and Beto for coordinating this session for Nuva and our people. So have a great day, everyone.
Thank you, everyone. Stay healthy, stay happy, and blessed. Thank you.
Thank you so much. Have a great day, everybody.
Thank you. Bye-bye.
Bye.